Here the detailed explanation of topic analysis and evaluation of symptom in context of Organon of Medicine for BHMS second year university exam specifically for Maharashtra. Introduction. Definition. Analysis and evaluation of symptom involve understanding and categorize patient symptom to arrive and correct diagnosis and individualized homeopathic prescription. Importance. It ensures a holistic understanding of patient, help in differentiating between common symptoms, physiological and peculiar homeopathic symptoms, guiding the selection of most suitable remedy. Step in analysis and evaluation of symptom. Case taking. The foundation of symptom analyzing start with detailed case taking as mentioned in Aphorism 83 to 104 of Organon of Medicine. Collect all symptoms systematically. Mental symptom example fear, dream, emotion. Physical general example appetite, thirst, sleep. Particular symptom localized pain and discharge. Classification of symptoms. Symptoms are categorized for evaluation. Common symptom found in most cases of disease fever in malaria. Derived from pathological condition. Characteristic symptom. Peculiar individualizing symptom. Coldness of one hand while other warm. These are essential for remedy selection or emphasis in homeopathy. Evaluation of symptom. Totality of symptom. Constructing the totality by gathering mental, physical and particular symptom. Hierarchy of symptom. Mental symptom greater than physical symptom. General greater than particular symptom. Individualization. Evaluate the what make the patient symptom unique compared to other with the same disease. Type of symptom as per organ. Type mental symptom. Example anxiety, irritability, sadness. Significance high priority in remedy selection. Physical general appetite, thirst, sleep pattern, thermal, chilly, hot. Reflect overall health. Peculiar symptom localized pain, rash, discharge. Support remedy selection. Modality aggravation and amelioration. Pain worse in evening, better form. Crucial for remedy differentiation. Peculiar strange rare symptom unique for casual symptom craving further. Key to find the similarium. Guiding for symptom analysis. Hahnemann teaching aphorism 105. The most striking, singular, uncommon, and peculiar sign and symptom case chiefly to be kept in individualization. No two patients are alike. Treatment must be based on individual symptom, pathology, and non-pathological symptom. Physiological symptom explain the disease while characteristic symptom aid remedy selection. Step in remedy selection based on symptom repertorization. Use of homeopathic repertory to match the symptom to remedy. Simillimum identified the remedy that close match patient totality, mismatch background. Evaluate whether sura, psychosis, syphilis influence the symptom. Role of the physician observation. The physician should cleanly observe all symptoms including behavior, expression, modality, holistic approach. Evaluate the patient as whole, not just disease part. Conclusion. The analysis and evaluation of symptoms from the cornerstone of homeopathic practice. By following Hahnemann guideline, a physician can identify the totality of symptoms, individualize the case, and prescribe the most effective remedy for the patient. This structure and content will help you prepare a comprehensive university answer. Let me know if you need more summarized vision or further assistance.